Well, thank you so much. It's really quite an honor to be up here in Buffalo and to reconnect with some of my friends and colleagues. We got to have dinner last night, and it was really very thrilling to hear about so many great things. I've been following the work of the Alberti Center for many years and have great aspirations for the wonderful work that you all have been doing and have been tracking all the great studies coming out of the center. So I'm very excited to share a little bit of some of the learnings that we've been doing over the years, and really excited about the work that you all have been doing every day in the schools. So every time I have an opportunity to kind of do a little bit of a deep dive and self-reflection on what I've learned, I'm always so excited and inspired by the opportunity to share out and hear from you all. So in thinking through what might be some opportunities for some shared learning here today, I'm eager that we are in rounds, so hopefully you can do a little bit of think-pair sharing at your tables here today. But there's always so much learning in the room, and hopefully these will be some of the guideposts for our conversation and thinking, what are you all doing in the schools, and how can we collectively maybe even reflect on what drives the work that you're doing, and how you can kind of come out of here with a little bit more energy than you came in. I come from a family of educators. My mom was a teacher, my sister is a teacher, my two nieces are teachers. And so every time I go home, I kind of hear a lot of these stories of like challenge, and I'm always like, oh my gosh, how can I try to do this a little bit better? And they're like, don't you study this kind of stuff? And what are we supposed to be doing? And I'm like, I don't know, I'm trying to do this. And they're like, didn't you write some book on this or get some grant about this? And I'm like, I'm just here to listen from you and learn from you. And so that's often when I spend time with educators and practitioners. I try to do a lot of listening and learning, and so hopefully maybe we can do a little bit of that today. But I know I'm the one on the stage supposed to imparting wisdom. But a lot of what I tend to do is listen. And the further I get along in my career, I try to do a lot more listening than talking these days. And hopefully we can even do a little bit of that together. But these are some of the goals that I would like to share a little bit of some of the evidence-based strategies that we've been doing. And I tend to work with really smart people that are much smarter than I do. And I tend to tinker around with their good ideas to try to make them a little bit better. And a little more what we call kind of transportable, and things that are easier for real life practitioners in the school to use. Because there are these big burly things called evidence-based practices that are really very scary for people, that come in shrink wrap boxes and that tend to sit on a shelf and are really very expensive. And I don't really like those, because we do these fancy things called randomized controlled trials of them that cost a lot of money, and I want to get those practices out into the field by talking to real life practitioners. So I come from another field called prevention science, and we try to unpack those shrink wrap things, hand them over to real life people, and see if we can get them out into the field much better. So I will talk to you a little bit about some of the strategies that we use. And we do that often in an equitable way, that we want to make sure that people that often don't have access to those, whether they live in rural communities or urban communities, or they work with youth from different backgrounds, then often have access to those kind of practices. So those are some of the values that drive the work that I do, and maybe those are some shared values that you have as well, that we can be on this journey together as we talk about that. I also come from a field where I think a lot about mental health and behavioral health. And for a long time, we didn't talk about mental health in schools. And so I would talk to some of my practitioner colleagues, and they're like, schools are supposed to be about education and academics, and we weren't really allowed to talk about mental health. And so we would kind of sneak things in, and we would talk about conditions for learning. So I talk a lot about conditions for learning, and we got to get the cheeks in the seats in order to teach kids. And so I'm all about getting cheeks in the seats, and we got to get everybody in the building, and we got to help people be safe and feel safe. And so occasionally there's a shooting or some other kind of crisis. And that tends to be a snapshot and a window of time that we can occasionally talk about mental health. And that's a window of opportunity, and I'm happy to take advantage of that window of opportunity. Or occasionally we have a pandemic, and that becomes another window of opportunity that we can talk about mental health. But now we seem to have a little bit larger window of opportunity. There seem to be some other policy changes that are allowing us to talk a little bit more openly about mental health. And I'm happy to take advantage of those opportunities, and I'm happy to go to my state legislature, and I'm happy to talk to policymakers about these kinds of windows of opportunity. And occasionally we have to use some data around that, and sometimes those data points kind of move around a little bit. For a while we were throwing out numbers of like 20% of kids had mental health problems, and so I used to have that number on the slide here. And so I'm actually going to talk a little bit about some of the statistics, because it's kind of helpful to be able to have some of those statistics in your back pocket when you are talking to different constituents. And sometimes those are policymakers, or sometimes parents, or sometimes community members. But the thing that's really very important for everybody to know is the vast majority of the kids that are identified for mental health concerns tend to get those needs identified in the school setting. And most of those kids get those support services also met within the school setting. And so that's one reason why, as a prevention kind of approach, schools are really on the front lines. Whether you want to be on the front lines or not, we tend to be. And we wrote this one paper called The Squeaky Wheel. And so it tends to be the kids with the externalizing problems that get identified. How many of you like have those squeaky wheels in your classroom? And in fact, the squeaky wheels, if they also have internalizing problems like depression, anxiety, we also wrote this paper. In fact, we put squeaky wheel in the title. They tend to, if they have internalizing problems, they often don't get attention until they start having externalizing problems. And so we even wrote this really fancy paper where we did this kind of comorbid type of analysis, and the kids with the internalizing problems often didn't get detected until they started having academic problems along with externalizing problems. So those kids with the internalizing symptoms often didn't get noticed. They were kind of quiet, they were sitting on the back row, and a lot of people just kind of overlooked them because they weren't coming to the attention of others. And that's why it's really important for us to really perk up our eyes and ears and maybe use mental health screeners or other kind of detection approaches, because those quiet kids are suffering in silence. So we really need to be thinking about them so that way they can get those kind of services early on. And this whole situation around mental health has been exacerbated by are there a problem with the slides? Is everything okay?
Oh, I was just thinking about if the sign was...
Is everything okay? Okay. So the whole situation has really been exacerbated by the COVID-19 pandemic. And so we have seen really skyrocketing rates of mental health concerns. And so this is an area, some of those, we have seen some of those trends shift around over time, and there were some very acute rates of mental health concerns. Some of those led kids to go to the emergency department, really high rates of increases of suicide attempts. And so not to be urgent, but we do have a crisis. I'm sure you've seen Surgeon General's reports, other types of reports. So these are very important. And in fact, I'm going to talk a little bit about just the recent data that came out from the CDC, from the Youth Risk Behavior Surveillance System. These just got released, I think, in the past 10 days or so. So not sure if you've had a chance to see these yet. But these are data that are collected every 2 years. These are just high schoolers. So if you're not familiar with this system, it comes out data collected from the CDC nationally from youth in 9th grade through 12th grade. This is not a study I conducted. This is a huge national data system that is collected in high schools. And so they have data across many, many years. And so it's very helpful for us to get a national prevalence estimate about how our kids are doing. And they have all different kinds of indicators about sexual behavior, risky behavior, all different kinds. I'm just going to focus on a couple of indicators, give you a chance to kind of digest this and think a little bit about this at your table and how this maps onto some of the data and some of the trends you might be seeing at your school. So kind of put on your thinking cap, think a little bit about what I share with you, because I want to have you think a little bit about how this might look at some of the trends at your school. So this one are feelings of sadness and hopelessness at school. So remember, these are kids filling out surveys at their school. These are very long clinical assessments. These are intended to be what we call a surveillance system, not people looking over with eyes and cameras. Often gets a little confusing around that terminology, but from a public health perspective, having kind of short, quick surveys that kids can fill out gives us a national perspective around them. So it's intended to be kind of quick questions that kids can fill out. But you can see some of these trends over time. And I also want to orient you to the way that this data is reported out. It's kind of a cool infographic when you think about the way that the data are reported. So the stop sign, the red, tells you if it's the data point is kind of moving in the wrong direction for that population. The yellow is no change, and the green is kind of moving in the right direction. So that's for these next couple of slides here. And so this is telling you the percent across these different years of this particular indicator. So you can see just these recent release data. So this is the 2023 data. It takes a year or so for them to clean the data and for them to release it for this particular one. So that's a lot of kids. We're seeing like half of our girls are saying that they are feeling sad or hopeless. That's a lot. So this is broken down by ethnicity. So we're seeing large portion, particularly of Black youth, Hispanic youth, pretty much across the board, but now this is disaggregated, but you see the numbers moving up when you break into these subgroups. This is still in the sadness, hopelessness. So when you break it down to females, so again, check out that gender minority population, 65% LGBTQ. This is just within that 1 year. So this is not trend data, but this is that subgroup. Let's shift over to looking at suicide, considering attempting suicide. High rates again among females. 27% for females. 14 among males. Breaking down among the subgroups, looking at sexual gender identity, LGBTQ, I'll draw your attention to that group again, 41%. That's within the past year. So what might be some factors contributing to this? These are epidemiologic studies, not necessarily just about this particular YRBS data, but there are a number of other different studies that are going on trying to understand some of these trends over time. Variety of different factors. We'll hear a little bit about social media this afternoon, of course, but that tends to be one potential contributing factor. Cyberbullying, declines in sleep. I've provided some of the citations here below, but there are some tighter epidemiologic studies that are trying to identify why might we be seeing some of these trends that are moving in different directions. The opioid epidemic, some really interesting studies about concerns about school violence and shootings. So not just at my school per se if there's a shooting, but even kids hearing about, knowing about rates of increasing school shootings nationally and exposure to media coverage of school shootings. And of course the pandemic is of a concern as well. So I have just a few more of these that I want to share, and then I'm going to give you a chance to kind of absorb them and talk a little bit about some of these trends at your table and how they map onto some concerns you might have. Safety concerns. This one really kind of caught me. I wasn't expecting that sharp increase in safety concerns, particularly among females. 16%, so this is did not go to school because of safety concerns. Pretty sharp increase among females, up to 16%. That's during the past 30 days. Bullied at school in the past year. This is, I've had some similar data collection and the state of Maryland that we've been looking at over the past decade or so. And again, some of these numbers do just naturally bounce around, so it's hard to be able to say, oh, this bounced up 1 or 2 percentage points. This is breaking down percentage of high school students who were bullied in the past year. You see the breakdown by gender, also subgroups, race, ethnicity, as well as gender identity. And this is the last one. This is electronic bullying during the past year. So I'll kind of flash these two back and forth because this is kind of interesting to look at rates of bullying and then the electronic bullying, because I think that's kind of interesting to see, because a lot of people are interested to see our rates of electronic bullying on the rise. And it seems like that's pretty flat, actually. So this is a good time for you at your tables to kind of do a little reflection. What kind of thoughts do you have about these trends? How does this map on to what you might be seeing at your school? What kind of questions do you have from a database decision-making hat? Let's take about 5 minutes to reflect on some of these data, and then I'll pull you back to see if you have any report outs. So it's about 9:10 now, so it'll be until about 9:15. Anybody feel comfortable sharing out some of the themes from discussions or any comments from your table that you thought were helpful takeaways that you think others in the audience might want to hear about? Yes?
I would just say that social media, I think, creates a lot of fear in
Fear.
kids, when there are rumors that are spread through various channels, and we've had a couple of threats that kind of come up that weren't even threats that end up kind of really just rippling through the whole community, and it ends up that kids don't end up going to school because they're afraid, and parents don't send their kids, or younger kids, and so we find that's one of the things that we found as far as safety goes, and how that has kids feeling less safe at school.
I was pretty struck by that increase in the safety concerns and not going to school, particularly among the girls, and what might have contributed to that. I feel like all these data points kind of lead me to ask more questions, and in many cases, that's kind of can be a good thing, can lead you to move in a direction of wanting to know more. A lot of the training that we've done with our schools, particularly in using positive behavior supports or multi-tiered systems of support, we had trained our schools to use school climate measures that would include indicators around safety and bullying, and using some of these similar kind of data points that were adapted from the YRBS and other indicators of school climate. We put it under a framework of school climate, of safety, engagement, and environment, and would collect anonymous surveys from students as well as teachers and parents. And we would collect those data in conjunction with the schools and provide that data back to the schools and use a data dashboard and provide that information back to the schools and encourage them to use that data to make decisions, and in fact have them share that data with students and the school teams, and to make decisions about the use of evidence-based practices, not the big scary ones, but the ones that empower them. And we would help them generate reports that would empower them to make effective changes. And so we've actually tested that model and helped them to make effective changes in the schools. And so we even helped them generate reports that were kid-friendly and share that data back to the schools. And some of them, we didn't have data on suicide, because that wouldn't be appropriate for kids to hear about those types of things, but more positive things about kids not feeling safe or bullying. And as kids, help us understand some of these trends, help us understand some of these issues in the schools. And we had a safety advisory group, including kids, and would talk to them about these issues. And to get to your point that you were bringing up, some of the social media, where are some of these concerns, and had kids advise us, how can we make changes? What are concerns that they had, and help them dialogue about these issues. So that way it wasn't just the adults taking away the data and using it, but really putting it back in the school's hands. And so we found that those models were actually very effective at improving what we called climate, because that was a very positive framing around it, and it was very helpful for understanding that. So I think those models can be helpful for empowering people to not just take away the data, but really putting it back in the school's hands and things like that. Other thoughts about some of these trends? Yeah?
Our table seemed just a little surprised at that there wasn't a big increase in the cyberbullying. Whereas I think when we talked about in high schools or middle schools, we're noticing a lot of that talk still out there. Younger kids, we're seeing more in-person bullying, but so interesting that the data's not really reflecting that.
Mm-hmm. And again, these are 9th through 12th graders, so have to keep that in mind. It doesn't necessarily reflect younger kids. So one thing to keep in mind. But, and this is national data. It's kind of weighted up to be representative of the country, so it may not reflect some of the local trends that you're seeing, especially among younger kids. Yep.
You talked about how LGBTQ youth in almost every slide,
Yeah.
be at the highest level, and we had a discussion about whether there are adequate interventions and opportunities for people to intervene.
Mm-hmm. Sounds like not. That would be my guess. And based on my review of the literature, that's certainly an area in great need of improvement. And my marrying around to a few of the tables, I think that was a pretty clear theme too. Yeah?
We also talked about the difference with girls in high school. Peer victimization starts to become more sexualized, and so there's more sexual harassment that might be getting conflated with bullying here. But I've done research that shows that sexual harassment really drives a lot of the negative outcomes, especially for girls.
Mm-hmm.
It could be that's part of it, and maybe why they're not feeling safe going to school.
Yeah, there is quite a lot of data in the YRBS about sexual assault and sexual activity, so I didn't have time to spend going into all the data, but I would encourage you to review other aspects of this report. I want to give you a little teaser about some of the recent findings. I'd also encourage you to check out some of the work of Dorothy Espelage, who does a lot of work in this area. I know she's been a speaker in the past, and she's a good friend of many in the Alberti Center and here at Buffalo, so she's an expert in that area and has done some of the really top-notch work in this area. So I'd encourage you to check out her research.
Consultant on our grants.
Excellent, yes, I figured as much. I wasn't really talking to you, I was kind of talking to the others in the audience here, putting a pitch for good old Dorothy here. But she does great work, not that she needs a pitch, but she does excellent work in this space, so. Yes?
We talked a little bit about perhaps there's an underreporting in males because of the stigma, still a stigma with mental health, or just afraid to disclose. I think we see that in schools. The males are less trusting to an adult disclosing that they need some help mentally, or that they're feeling emotionally depressed. Almost just that males shouldn't feel that way. It's not in their nature to feel that way, whereas women, girls are more apt to disclose that and get help. So it's just a question.
Yeah, the reporting bias certainly comes up. We talked a little bit about that at a couple of the tables too. There's some psychometric kind of fancy analysis types of things that the folks at the CDC, I think, can try to do to address some of that. That monkeys around a little bit with the analysis. It's called differential item analysis. So they try to address some of those types of things in their analytic approach. But to your point, there are always going to be, when you're looking at self-report data, people that are going to underreport or overreport certain things based on their comfort level level in these types of analyses when you're talking about self-report data. So that's a challenge, and I think that's one reason why they do anonymous surveys, to try to help people feel more comfortable, and they often will try to reassure that nobody's going to know the answers to these types of things, but it is always a challenge to try to understand why we do see those kind of consistent differences around the gender in the reporting. Any last remarks or thoughts around the data? I appreciate your deep dive into data reflections. Maybe this has piqued your interest to look a little bit more, or to reflect on some of, if you have access to any kind of data or surveys. Anybody at your school collect any kind of survey data? Oh, one more question, comment?
Yeah, in the disproportionality of LGBTQ students,
Mhm.
that piece, me and the representative from Catholic Charities were talking about what we've seen in schools, and being in an organization that explicitly works with LGBTQ youth, I feel that I can kind of speak to some things that I've seen. I think other than the just baseline political climate, transgender people are being attacked in campaign ads very blatantly. In actual schools, they're in specific gender sexuality alliances, the club in which the LGBTQ kids are housed and they find a safe space in each other. There's kind of a divide in the student body, whether they feel the pressure to advocate for themselves or whether they were to rely on administration and push administration for more enforcement of anti-bullying practices, their, respect for all students acts that are enshrined in their own school's bylaws, or whether they feel the sense of justice to go out and do it themselves, which is just something remarkable that I've seen in kids that young, to have an enlightened sense of justice to go out and do that. So I think there's a confluence of factors contributing to the disproportionality in LGBTQ kids, but I wonder if one of them that may go under or not seen on the surface is just LGBTQ students feeling the pressure to be their own advocates while experiencing hatred and abuse that way.
And you imagine what pressure that's putting on them when we look at the other risks that they're facing. So the idea that we would expect them to be their own advocate when we are already seeing the levels of vulnerability they're experiencing. So not to pathologize them, but to say, oh, how can we expect them to be their own advocate when they're already experiencing these other levels of vulnerability? So we need others, particularly adults, to be their advocates and stand in that space for them. So thank you very much for your points. They're very well made. So in that space, I want to highlight when we are talking with the kind of bullying hat on, we need to be, as adults, particularly sensitive to issues of bullying, harassment, victimization among all of these groups. And what we've seen in the literature is adults have a difficult time detecting issues of bullying in the classroom. And so we have long bodies of literature that have noted this. And so adults historically have a difficult time recognizing bullying that's happening in the classroom. They historically failure to recognize how important it is to intervene. And I'm not trying to blame the adults here because they're really busy. There's a lot that's going on. There's so many demands on their time. There's a pretty heavy cognitive load that's going on for adults that are teaching, driving a bus, managing a cafeteria, having so many things that are happening. And in fact, there's often a lot of uncertainty how to manage a conflict, a situation that's complex, whether it's an LGBTQ situation, whether it's a situation of a child with technology, social media, sometimes just not really understanding how to navigate that situation, whether it's the technical aspects or the social aspects of the situation. And then there's a sense of, well, maybe I'll just kind of ride this out, or maybe I didn't really see that. What do I do? And just the lack of time. And so this contributes to a lot of disconnect between kids feeling like, did they just see that? I'm pretty sure that adult saw what just happened to me, and I can't believe that adult just turned a blind eye to this situation. And they're condoning that, they are supporting what's happening, they see what's happening to me. And in many cases, kids just aren't reporting what's happening to the adults, and they feel that the adult is supporting the bullying because they're passively condoning what's happening. And if the adult is sitting back waiting for the kid to report it to them, they're kind of out of lunch, out of line with what's going to happen, because we know that relatively few instances of bullying get reported to the adults. So if we're going to sit around and wait for the kids to report it to us, we got to break this cycle, because that's just not what's going to happen. We can try as much as we want to, and we can try to change the narrative and get kids to report things, and that's really the underlying goal of a lot of bullying prevention programs, and I will continue to try to get kids to report things, but we got to have a both and. We got to get kids to report things, but we also have to get adults to be more sensitive. So we got to meet in the middle on both of these situations here. And so these are a variety of factors that contribute to that disconnect. And so we have a lot of data in this. I've done this study kind of a couple of times now. And so I want to give some examples of this disconnect. And again, really not trying to blame the adults, because there are a lot of reasons why we have this situation that has kind of created this perfect storm. And this is one of the studies that we published many years ago, but is oddly enough one of the studies I get cited for the most, because it's one of those like basic things that is like proving the obvious. And we did a very large study of 15,000 students, and just under half of them, 43% of the students, said they had seen adults in the school watching bullying and doing nothing. 58% said they believe the adults in their school are not doing enough to stop bullying. And 61% said that the adults in their school only made the situation worse when they tried to actually intervene. So when we asked the same school staff in that building, 1,500 of them, 1,500 of the staff, 97% said, overwhelmingly, these are good-hearted people, I would intervene if they saw bullying. So there's a clear disconnect in this situation. I would try to stop bullying if I saw it. 87% thought they had effective strategies for managing the situation. And a mere 7% believe that they made situations worse. So we've got to break down between what the kids are experiencing and what the adults are experiencing in these situations. And I had the courtesy of my friend and colleague, Sue Swear, gave me this slide many, many moons ago. It was an activity out of one of her bullying curricula, where it was having a kid draw a bully when adults are around and not around. And you can see on the left-hand side here, we've got the angel, a bully when adults are around with a halo on it. Kids can be really good at code switching in and out of the bully scenario of, oh, they can seem really, really good. And then when adults aren't around. And so inspired by this long I'm not certainly the only one to publish a study like this now. I teamed up with a colleague of mine, Tracy Wasdorp and Elise Pass, and we decided, how can we figure out a way to give adults opportunities to practice detecting bullying and intervening and kind of get a do-over, because we all kind of mess up. How can we practice situations of detecting bullying? So how can you figure out a way to actually learn to detect bullying better and intervene? Because we kind of do stuff that's not so great sometimes. When you say things that aren't great and you're like, man, I botched that one. Can I roll back the record and try that again? And so the first step, if you miss it, you're kind of out. You missed the opportunity. It happened in the classroom. And in fact, a lot of bullying happens in the classroom, statistically speaking, because kids spend a lot of time in the classroom. But teachers are kind of busy in the classroom. And so it'd be nice if we caught some of the bullying that happened in the classroom. I know there's also a lot of bullying that happens on the playground for younger kids, because that's kind of a time when kids are interacting a lot and teachers are hanging out in the back, they want a little bit of a break too in the cafeteria. So there are a lot of different settings where we could give teachers an opportunity to practice these situations. So wouldn't it be nice if we help teachers learn to detect bullying in real time and actually practice intervening and had a do-over in a safe spot so that way nobody got hurt? And so we decided to use a teaching simulator to provide that opportunity. So I don't know if any of you have ever used a teaching simulator. Have any of you, by show of hands? Okay. So we used this one, and it's a product that was developed by a faculty member who at the time was at Central Florida, named Lisa Deeker, and she's now at Kansas. And it's called Teach Live. And so there are a simulated environment of, this one is kind of a seated classroom where there are 5 different personalities of children. It's now been commercialized to a product called Immersion. And so it's used also in pre-service, how to train teachers. And so much like, we don't send pilots up in the air on real planes with real people, it would be kind of nice if we practice teaching in a simulated teaching environment. And so a lot of pre-service environments are using this now for training teachers and even training clinicians in other fields too. So we often will train clinicians as well, especially with high-risk cases like potentially suicidal clients and other types of things. So we decided to use it to train teachers how to detect bullying and then how to intervene in those situations. Because teachers might not say the best thing when a kid says the F-bomb or calls a kid a certain term, might call a kid a faggot or something like that in a classroom. I'm sorry to use that word, but I'm just trying to be real with some of the situations so that way we could actually use a term that a teacher gets anxious. Like I just used that word that actually made me feel anxious, may have made you feel anxious. Sorry, it's on the recording. But I wanted to use a term that made people feel anxious, because when I use that term, I feel anxious, you feel anxious, and now we have to practice calming down. In a simulator, I need to practice calming down so that way I can actually intervene in that situation. And so I've got to learn to regulate my emotions so I can actually intervene effectively. And so I can be like, all right, now how am I going to learn to calm down and label that behavior and intervene effectively? Because if I've never had that experience before, I don't know how to deal with it in real life. Because when it actually does happen, if I've taught in all these protected environments and then I get thrown in the deep end and I've never had a scary, unpredictable, off the rails kind of situation, what's going to happen when I go into the real world and I got to deal with that? And then I can do it poorly, and I can train myself from a physiological situation. How do I actually learn to regulate my emotions in a protected situation where there's not a real kid, where I have a coach there that can help me learn how to do that? And we actually even put wristbands on teachers using Empatica wristbands, and so we could see the heart rate spike. And we could actually look to see, all right, you just went off the rails. We're going to learn to modulate that, and let's calm down and try that again. And so we could coach the teachers to be able to do that. And so we got a grant from the National Institute of Justice, kind of cool, and to develop this. The technology was already available, and so we adapted it for this bullying situation. And so we used the technology and did this pilot, and it worked pretty well. So we at the University of Virginia had been also using it for training our pre-service teachers, not just in classroom management or bullying in the context of this research project, but also math and science and other types of ways. So I know there are a number of other sites that are using it. And NSF has also invested in this technology. My colleague at the University of Virginia, Julie Cohen, does a lot of work in this area as well. So there are other applications of teaching simulators. So these are some other snapshots of others that have been using it as well. So I had led a pilot on the pre-service area, so there are a bunch of other folks that are using it too. So this is now being applied with AI to help develop the technology. In this case, these are 5 kids. There's actually an interactor. There's a human on the back end kind of interacting and responding in real time. And so we can write out the script about what's happening. And I mentioned helping teachers detect bullying. So when we did it, we could actually program out like it. They would go in for about 15 minutes. We'd be able to program and say, 30 seconds, there's going to be a bullying situation. A kid's going to bully this way. There were social situations. There were physical situations. We also had a racism discrimination. We had an LGBT. So we were able to program out the different situations. So we were able to train the teachers to detect bullying in different forms. And then we had harassment as well. So we had different simulations so we could train them to detect and then how to actually intervene. And so we would train them up, and then we'd send them into the classroom and then look to see how well it generalized in the actual classroom environment. And so we did a randomized trial, and then we finished the National Institute of Justice project, and now we have a trial going on now that my colleagues Elise Pass and Tracy Wasdorp are finishing up. It's funded by National Institute of Child Health and Human Services, NICHD. And then we just got another set of funding to actually bring kids into the simulator to help them practice certain kind of situations as well. That will include a social emotional learning curriculum that Steve Leff developed called Praise. So we'll be having teachers go into the simulator as well as kids. So that way kids can practice implementing certain kind of strategies as well. So downside of simulator, it's kind of expensive. We're also trying to build in a little bit more AI on it. But any kind of thoughts about simulation as a practice form? You know, we've been using role play for a long time, so it's just a fancy version of role play, but it's a little bit more controlled and potentially allows people to have that a bit more contrived and a little bit safer space. So that way in a role play, kids can kind of goof off, and there's also potential for deviance training that can happen too, and that is a way, that's kind of a concern when we do some group interventions, that kids can start using language and aggressive behavior as a way of one-upping each other and actually increasing the likelihood of aggressive behavior through modeling of problematic concerns. Any kind of thoughts on this topic? Yeah.
Did teachers like it?
Teachers did. So we always do like feedback sessions and we iteratively develop things. Teachers do like it. In the pre-service program, teachers did get a little stressed out because it was part of their training. They felt a little potentially evaluated. But we were like, hey, this is not the real world. This is a simulation. The real world is when you go in and they're like real live kids. And isn't this a good way to practice before you go into the real world? But we also found in our pre-service, so by pre-service that means like before you get thrown into a real classroom, and the real world, when you get with a mentor teacher, when things go off the rails, the mentor teacher takes over. And so we need actually people to learn how to manage difficult situations before you are really taking over the classroom. Yeah?
I'm just wondering how it translates. I know with other types of virtual reality type of things, it doesn't always translate over to the real world very well. So I'm just wondering if it is translating well, and kind of since they're expecting that there is going to be that bullying scenario, it seems like it would be easier to identify it since you're looking for it directly to happen rather than in a classroom. You don't really know if it's going to happen. Type of thing.
Yeah, well, they would even know it was going to happen, and it would still catch them off guard. They're like, oh my gosh, I still wasn't ready. And they were like, okay, I got to do it again. So we would still have even though they knew it was going to happen, we didn't say it's going to happen in 30 seconds. They knew that there was going to be, they were like, all right, I'm ready. And so they knew something was going to happen, but they didn't know exactly when. So in terms of generalizability into a real world situation, it was, trying to help them practice responding to those situations. Part of our goal is to build their efficacy and their confidence, because we're trying to train and build that muscle for how to respond and their ability to manage those situations. We did find that they were more likely to use the strategies that we had trained them on when they went into the real world classroom, and that they reported greater efficacy to manage those situations. When we did observations in the classroom, they were using more of the strategies, but it's kind of hard to catch like a bullying situation when we did the observations in the classroom, but they did report greater efficacy to be able to manage those situations. Yeah.
I think this program is great. My hope is that it becomes more affordable for schools to have them, especially during COVID when pre-service teachers didn't have that experience. They had to teach online with their mentor teachers. So I think this would be a great training for especially those schools.
Yeah, you can Google the immersion software and use that. We do kind of bank all of our scripts and things like that. So immersion does have access to the bullying scripts and things like that. Yeah.
So we used it for a period of time as well, and I thought that it was, and Buff State, I don't know if anybody's here from Buff State, but they have used I call it Teach Live. I know it's changed now. But,
yeah, Teach Live was the original technology, and then they created a spin-off company called Immersion, so that way outside consumers could access it. Immersion was more the research arm. And then Teach Live was the research arm. Immersion is now the commercial product.
Right. So Buff State.
I don't make any money off of this. I just want to be clear. So there's no CIY on my side. So.
Yeah, Buff State did a lot with Teach Live. I don't know if they still are. So some of us were trained over there, and then we did it with some grant funding at UB for a little bit. And at the pre-service level, I found it really helpful. I think the students were a little bit anxious about it, but really did give them a chance to practice. The one limitation I found, which I don't know if it's changed, was they only had 5 students. Mm-hmm. So it was very hard for more, like when we tried to do more classroom management and things, like if you wanted to kind of scale it up,
to move them around.
Things, there were a little bit more, but I would love if I don't know if they've advanced or improved or things like that, but just some reflections.
Yeah, they've also, these are some earlier images, the ones that we tested in that project. They have some younger ones. They have like younger kids that are sitting on a carpet. They also have some that have kids with disabilities, but they don't have like, my colleague Tracy's like, when are they going to get in the playground? When are they going to get in the cafeteria? We want kids moving around so they can like hit each other. So, she's not very patient with me or with the technology. So they because they're avatars, they have to kind of sit down. And so we are hoping that they'll be able to kind of push the envelope a little bit more. So I do want to kind of talk a little bit about some of the on-the-spot training, because as I was setting this up here on this conversation, how important it is to be able to be detecting those situations and responding. Because the point I was making there is if we aren't seeing those situations and if we aren't responding in the moment, we are somewhat passively condoning the bullying situation. So in my kind of public service announcement piece of this, I want to make sure we hit a few of the highlights of how important it is to be able to do this. And hopefully this is a refresher for many of you bullying experts in the audience here. So I did want to hit a few of these before we kind of go into a break here before too long. So I want to chat a little bit about a few of these refresher things, and hopefully you have some ideas about how you do this in your own setting. So the importance of supervision, just adult presence. We do a lot of observations in schools, as I'm sure you do. We have a technology that we call the safety, where we go around the school and we observe adults, and some of this is built on the great work of Ron Astor, who I view as one of those, meccas in your field. He had this task where he had kids go around the school and have like a map, and he would literally have them draw like put X's on owned and unowned spaces in the school. And so we loved that concept, and we were like, let's go in the unowned spaces in the school and do observations there. And so like the hallways and the back stairwells and the cafeteria. And so we go hang out in those spaces, and we're like, how many adults are present? How many activities are happening where there are no adults around? And so that's where a lot of this stuff is happening. And so we need to just have more adults present in those spaces, especially when classes are changing over. Because that's where a lot of this activity is going down. I did also acknowledge that some of the stuff is happening in the classroom just because kids spend statistically more time in the classroom. And when we collect data from kids and say, like, where are you bullied? A lot of kids like say, in the classroom, because I'm just in there a lot. So let's not overlook the importance of the classroom and the importance of effective classroom management and having a good classroom system. So make sure that the staff have good on-the-spot training and know what to do in those moments. And in fact, we're going to do a little bit of role play on that when we come back from break, so get ready. Hold some meetings with students that are involved in bullying. That's going to be one of our role plays. And develop intervention plans with all students that are involved, not just the kids that are acting out the bullying, but also the kids that are potentially the targets of the bullying. So intervene immediately, get another adult to help if you need some backup, name the bullying behavior, and refer to the school rules. I'm trying really hard not to label the kids. I'm trying to label the behavior. So if you note that's what I'm doing, I'm hoping you will do that too. I'm trying to model that for you. So we're labeling the behavior, not the children. So we want to separate the kids that are involved. We want to make sure that everybody is safe and feels safe. So the physical act of being safe is one thing, but also the emotional experience of being safe is another thing. And if you have a history of trauma, it's really hard for you to feel safe. And so we need to continue to check in with kids that have a history of being victimized and being traumatized, because their experience of being safe might be different than the school's actions to make them feel safe. So we need to make sure that we are checking in with them about their feelings of being safe. So they may also need medical treatment and mental health supports. Engaging the bystanders, so people that might be exposed to the bullying, because that also sets out a certain norm and may shift the climate within the school. If there are a lot of kids that are being bullied, that sets out a norm that there's a lot of bullying that's going on. Bullying becomes the norm within the school, and that sets a lot of secondary anxiety within the school. We also need the adults to stay calm and that they don't panic. Reassure everybody, including the bystanders, that there is a plan in place. We don't have to include all the details of the event to everybody that's involved, particularly the bystanders, but they all need to know that there is a plan and that there's going to be a follow-up. And we need to model respectful behavior when we intervene. Hopefully we know what that means, but we might need to operationalize that within the school setting. And we also need to impose immediate and appropriate consequences. So what's the difference between a consequence and a punishment? Yes?
Punishments often revolve around taking the child out of the school, or suspensions, or removing the kids from their peers, and consequences can be more revolve more around restorative practices and atonement policies.
Yeah, and there can be a variety of different consequences. And consequences don't necessarily, I mean, you can have consequences for behavior that don't necessarily mean that they're getting punished. And we want to be clear with the consequences of a certain behavior. And sometimes parents are like, where's the punishment? I want to make sure that everybody's punished as a result of this. And sometimes that's a really tough conversation to be able to have. And sometimes punishment is, the end of the line for everybody. And some schools do have clear consequences, and some schools have clear punishments. And some schools need to figure out which they want to have. And you might be in a school that is leaning more towards punishment, and you might want to be a school that values more consequences rather than punishments. And so that's kind of a value statement about what your school values. That's probably an important conversation within the school about how you set punishments versus consequences. And following up with the family members and related parties. Some strategies about talking with the target of the bullying. Some people don't like the word target. I could understand that the word target may not be better than victim, but there are challenges around some of our terminology, so that's an important thing to think about as well. Talking with a child that's been involved with the bullying, directly stating that the bullying is wrong, whether they, being clear that they don't deserve to be targeted in that way, directly stating that aggressive retaliation is not right, listening to the concerns, and coaching on those strategies, and peer support in those situations. Any thoughts about this list and which of these is kind of harder or easier for you all to do? Yeah?
One of the ideas I used to share with educators was for children who experience, I was a desk trainer for quite a while, so this was part of what I shared with educators. And I don't take credit for this idea, I'm sure I read it somewhere else. But for kids that tend to be chronically picked on by other students, one way to help them out is to give them some sort of little card that they can carry on their person all the time. And if they're in a situation, whether it's the playground, the cafeteria, the hallway, and they're experiencing bullying, approach an adult and show them that card, and everyone in the school knows that kid needs to go to a safe place, needs to get out of the situation. You don't have to turn it into a big deal, but you give that kid knows that any adult will respond in a positive, appropriate way given a situation like that. And the safe space could be the nurse's office, or go sit with the secretary in an office, just to get the, because lots of times kids can't just get out of a situation in a school. Their procedures, and they're going somewhere, and maybe they always get stuck in line at lunch with that person. So that was kind of a quiet, private way of
Yeah, like your little cue card kind of thing.
Exactly.
Yeah, that's excellent. That's a really good suggestion. I like that one. Any other thoughts on this list? Things that you don't like, you want to vote off this list, or you want to underscore? Or you're like, I don't think that's going to work for me. Yeah.
I kind of really like what you just said, because telling the target or the victim to avoid situations that have a lot of the responsibility on them.
Mm-hmm.
I think what she said, it really puts the responsibility back on an adult in terms of, we need to get this child to a safe space rather than putting all the responsibility on the target, because I think we do that a lot with bullying, say be the bigger person, avoid this, avoid that, and really it's not their fault they're being bullied, but it kind of reinforces that it is their fault and that they can avoid it by doing something.
I get that. Yeah, the avoidance thing, it's a little controversial, but sometimes, it is a little challenging, but there's all right, well, everybody's gotta ride the bus to school. Well, can you sit in the front of the bus or the back of the bus? And sometimes it is just a strategy to try to give them some sense of control about all right, well, you could sit somewhere else in the cafeteria. It gives them some sense of empowerment if I can control something in this situation and some way of dealing with that. When kids unfortunately can't control a lot of things about the school environment, but there's all right, well, I could do this one thing. And maybe it's well, I can't not go to school because I've been skipping school a lot, but maybe I could do this one thing to adjust my behavior to try to do that. It's a small correction as compared to the big correction. So it is not optimal, but given the degrees of freedom that they have, it's like a little bit of a thing. Not great. Others? I welcome other additions to the list. I'm gonna have to steal your card though. That's a good one. Other things, I know you all are, many of you are on the front lines. I welcome other suggestions. This directly stating that aggressive retaliation is not right, that sometimes is a tough one. Anybody have any ideas or strategies to coach around that one? Yeah.
Where's the piece about having, I'm working with families in the town, I'm a former speech language pathologist, 2 children who go to schools. One is in a middle school with a pretty long history of bullying problems since COVID. And one of the things that comes up in our conversations is why aren't the parents trying to talk through the dynamics with one another? I know that we can't, like, with the regulations, we can't as a school report to parents the children's names, but as a community, I feel like there's this piece missing where we're not engaging as adults with one another to try to create safe spaces for our children.
So if I hear you, the strategy you have there is talking to the parent. Yeah, I have a slide on that. So this was like, how do you talk to the kid that's been the target of the bullying? So I can get to the parent piece here. So you have some, it sounds like some good ideas there. So I'll get to that one just a second. So this one is the kid that's been the perpetrator of the bullying. So I'll list this one and then we'll get to the parent piece in just a second because I love your ideas around that one. So this is the perpetrator of the bullying. Talk directly to the child, label the behavior as the bullying, foster open communication, engage the parents. I probably should have had the parents on the last slide too, but you have a good addition on that one. Seeking mental health services, develop a process like a behavioral matrix for monitoring the behavior at school, at home, rewarding pro-social and non-aggressive behavior, kind of replacement behaviors, and try to understand the factors that contributed to the problems. Anything you want to vote off here, add to the list. Could be much longer, I'm sure. Trying to get in the on the spot, kind of what do you do there in the moment, in the 24-hour, kind of first 12-hour type of thing.
I don't have a question, well, I don't have a comment or an addition, but I'm interested in hearing more about the development process, the behavior matrix for monitoring behavior at school and home. What does that look like?
That kind of comes out of the positive behavior support world. We have some behavior support matrix that we use in the positive behavior support or MTSS kind of framework. I'm happy to give you some examples of that. So it's just being a little bit more specific for the bullying behaviors and behavior replacement type of matrices that are distilling it down to replacement behaviors for bullying more specifically. So it's kind of doing like a little mini FBA, functional behavioral assessment around the bullying behavior in particular to see if we can understand why they might be bullying. So it's kind of getting a little more specific around that and trying to get some alternate behaviors for the bullying behavior.
So sorry, can I just clarify? So would it be like a daily progress report card? Okay. Thank
Yeah.
You. Thank you.
And then kind of drilling down on the bullying behavior in particular and saying, doing like a functional behavioral, kind of mini functional behavioral assessment light around the bullying behavior and then trying to do some communications with the parents in the classroom around the bullying behavior in particular. So it's kind of taking a PBIS lens to the bullying behavior. We can chat a little bit afterwards, maybe at the break, around some strategies around that, and I can send you some tools that might be helpful. So kind of digging into the parent piece a little bit more, sending home materials to the parents, thinking a little bit more about policies that would engage parents, open communication on the front end. Before bullying happens, what are the policies, and sending those home. We wrote this piece a couple of years ago about encouraging parents to have the talk about bullying, kind of like having the drugs talk, the sex talk, having the bullying talk, kind of getting that into the nature and the vernacular for parents, getting them to talk about bullying with their kids before it happens, much like they have other kinds of talks with their kids. And I also worked on kind of a national campaign with some bullying prevention stuff. And when we were working with the Ad Council, and they were like, wow, we did all this focus groups on the National Ad Council, and parents, it didn't play well with focus groups with parents to think about their kids being a bully or being a target of bullying. But it did play well with these parents, for their kids to be a bystander. And so we wrote up this big, huge national campaign about having parents think of their kids as being an upstander. So there was a national campaign for parents to talk to their kids about being an upstander. So talk to your parents about having their kids be an upstander. So that's a much safer space for parents to think about their kids as being upstanders. So that could be part of that talk. So it's safer for me to talk to my 13-year-old about, oh, let's be an effective upstander for your friends, because that's a safer place to start that conversation. And so that might be a nice way to roll out and start those conversations, and helping parents recognize the signs and strategies. Also getting parents to contact the school if they have concerns. The parent's like, I'm going to just call that other parent, handle this myself. That doesn't go well, because that's when they get into the he said, she said. So the parent-to-parent conversation, they're like, oh, I know them. I'll just give them a call. I do jazzercise with them. Yeah, that doesn't go very well, because then they all think that their other kid started it. And you should take that phone away. I know your kid started it. That never goes very well. So the school should really be the intervener and the manager of these types of issues, rather than managing this themselves. So these are all things that we really want the school to be part of the convener and the manager of these messages. And I think I heard you kind of allude to this earlier, but when you are talking about this, rather than using the child's names, you should talk about this. I remember I picked up my kid from camp one day, and it was actually the day one of my books on bullying came out, and I was kind of feeling pretty good. I got the big box of the bullying books that came out, and I go pick up my kid from camp, and my daughter's like, oh, they want to see you in the office. And I was like, oh no, this is never very good. And it was like a day camp, and my daughter's like, I think she was in first grade or something, and it was a summer camp, and it was a Montessori summer camp. I won't say the name, but I go into the office, and my daughter's like, there was a note in my backpack, and she's like, I can't really read, but there's some angry note in my backpack. And she's like, I think I was bullied. You know something about bullying, right, Mama? And I was like, yeah, I know a little something about bullying. And so the camp showed me the note, and it was like a quote death threat kind of for first graders or whatever. And I was like, just kind of, let's see how the camp handles this. And I so wanted to take a picture of it. My daughter's like, don't talk about this in any of your workshops, Mom, please. Please don't take a photo of it, please. I'm just gonna be scarred for life on this thing. And so my daughter's like, I know what happened. Those two girls know each other, and I'm new to the camp. And they thought I was, working my way into their relationship. And so that's why they were upset, and that's why they wrote me the death threat. And I was like, man, you're pretty good. So they were young, but they were pretty young writing about this, and it was kind of cute. But it was, not really a death threat, because they were like in first grade. But I was it was interesting to see how the camp handled it. And they didn't use any of the names or anything like that. But I did ultimately figure out who some of the other parents were. But I thought the camp handled it pretty well. But they didn't tell me who the names were, but some of the other parents kind of later on disclosed who it was. But you know, some schools are pretty good at handling it. But it wasn't just school, it was like a camp, it was a day camp and things like that. So I think it is, you know, some places do handle things well and sometimes they don't. And some parents will disclose, you know, certain things, and I think it's good to be able to be on your guard for these kinds of things. But, you know, I didn't dismiss the issue, but it was interesting that my daughter kind of understood the situation and also shared with me about it, even though she couldn't actually read the words on the note. So it was interesting how she had kind of processed that. But I did promise her I could use it in a talk, but I just couldn't take a photo of it. So we had worked out that agreement. So just a few last things here before we get into this. Coaching, kind of I do have the avoiding the situation, so I appreciate the concerns about the avoiding. I did tell my daughter, I was like, well, maybe you shouldn't kind of hang out with those girls tomorrow in that situation, because she was like, well, maybe we should kind of let things simmer down. But I recognize that that may not be the best thing, because, you know, sometimes you want to confront things head on. Sometimes you want to let things kind of simmer down. Avoidance can be helpful. Sometimes that can be harmful. You know, conflictual situations can sometimes escalate, and sometimes you want to manage things with assertiveness, and sometimes you want to let things kind of simmer down. So I can understand how that can be positive or how that can be negative. Monitoring is important. Collecting documents. The documentation can be important. I get a lot of calls, as I'm sure some of you do too, about situations where these have escalated, and sometimes parents do need to be able to collect information to be able to document in the event that they need to go forward with a more formal grievance situation. So collecting information, especially from a school's perspective, both on the parent side as well as on the school side, to be able to collect that in case the situation does escalate. There are some apps that can be helpful, and media literacy. There are some really good resources for parents. I'm a huge fan of the stopbullying.gov website. The government has spent a lot of time and energy collecting information and putting it into one-stop shop. I've been involved with this resource over the years, and I would really encourage you to take a look at that. It's helpful. They have resources for youth, they have resources for educators, administrators, as well as parents, so I'd encourage you to refer folks on to these different sources. And so a little bit more comprehensive when you think about different kinds of programming, moving away from the kind of on-the-spot approaches to thinking about different programs. I'm a big fan of social emotional learning programs. We'll talk a little bit more about some of the systematic approaches after the break. But teaching skills, how to manage emotions and how to address some of these challenges, both for youth that are directly involved in bullying situations, how to tackle these issues more directly is very important across the life course, not just for kids, but for adults too. This is very important. Foster supportive relationships among students, staff, and parents, very critical. Reinforcing positive relationships in a comprehensive system. I've done a lot of work on positive behavior support as well as social emotional learning, and those are important comprehensive systems to lock in and use multi-component approaches across multiple years. I'm not a big fan of like, oh, we're going to use second step, or we're going to use paths and just use it one time and think that that's going to be some kind of magical approach to solve these issues, but really sticking with something and using it in a comprehensive way over multiple years. And I think you get a lot of bang for your buck by using multiple approaches, but having a universal, comprehensive approach. And recommended core components, you really need to train your teachers, thinking that you're just going to be able to pull out kids that are directly involved and send them to the counselors for one-off counseling sessions. You might have an excellent counselor that's going to be part of this equation, but you really need to be training your teachers because they're going to be a critical component of this approach. activities for students, so that way they can be part of that Upstander campaign, and beyond just a campaign, but really part of that comprehensive approach. We talked about the critical role parents will play. Multiple component programs have consistently been shown to be most effective. Having a school-wide approach and a continuum of positive supports and data. I think data continues to come out as a core component in the meta-analyses. And we will take about 5 minutes or so to practice role-playing, intervening in said situation, and role-play how you as the adult would intervene. So for example, I might choose intervening with the young woman here with the backpack on, and let's say I were the PE teacher coming into the situation and discovering what's happening. What would I do and say to the young woman here about the bullying situation that's happening? How would I intervene with her and the other youngsters in that situation? So what would I say to her? What would I say to the other youngsters in that situation? So we'd spend a little bit of time at the table talking about that and role playing. So I'd role play what I would say to her, and then what would I role play to the others. And please, have somebody respond back and tease out the situation a little bit, so that way it seems interactive, so that way it seems lively. And if you do that situation and then you want to choose another one, so that way you can take turns a little bit playing around. So we'll do this for about 5 minutes at your table, so you can choose maybe 1 or 2 of these different scenarios to play out and take turns and reflect a little bit at your table. And just so you know, you all got off easy on this. I usually have people do the role play in front of the group, so you got to do it privately at your table. So I usually have more formal and public role plays going on. But any initial reflections on this role play for the kids? I can do the pregnant pause. You all know this is an opportunity to respond.
Hi everyone. So one thing we learned about that while dealing with both parties, bully and the kid who's being bullied, is validate both sides of feelings and try to make sure that they know that what's their perspective and where they're coming from. And it applies for both the people, like the bully and the other person. And same with the parent, when you call a parent to let them know about their child, to let them know that what's going on in the school, but at the same time validate the parent's feeling. Even if they're trying to defend their child who's doing the bullying, and understanding on both sides that where the both parties are coming from. Thank you.
Excellent. Yeah. Looks like we have another volunteer that there was another one at that table. Do you want to? Yeah.
So as kind of the social worker counselor in the situation, I think that it's important to dig deeper when it comes to the perpetrator, because I feel like I think it's like treating the symptom of the issue, and I think it's more of a problem. So with kind of facilitating open-ended questions, I was able to kind of dig to the root of it, which was kind of that maybe they were feeling kind of threatened by the other child's academic performance, and that maybe they may be feeling some insecurities within themselves. And I think that in order to properly handle the situation and go about kind of figuring out what the best solution is to kind of figure out where it's coming from, not just reprimanding or trying to get them to take responsibility.
Great. Well, I appreciate your kind of going in, listening. Both of you reflected that listening with some with parents, some with the kids to understand the situation without necessarily preconceived notions about what was happening. Great. So it looked like we had a few other hands over here too.
Put your hand for power.
I think we have a mic shift over. Did you want to turn off one of those mics? Because it sounds like there's some feedback on there. Maybe while you're there, you could stop at this table, because we had a really interesting dialogue about should we label it bullying or should we label some of the behaviors. Could you all comment on that while you're right there? Oh, no, right behind you.
So the conversation we were having is about, one, trying to understand the situation in general before we label anything. And I talked about my point of communication is always to try to figure out what the goal is, as opposed to labeling something. Because the fear is, if I label something as bullying, and a child gets really defensive and just shuts down and can't hear me, great, I called it bullying, but did I get anywhere else with it? So that was mainly the conversation.
Yeah, and it kind of led to a whole conversation about once you label something bullying, I know we're talking about bullying today, so everything kind of looks and smells and feels like bullying, but then we kind of went into this like, well, what are the pros and cons of labeling something bullying? Kind of, we walk into the situation, we say, that's bullying, ha ha ha, and then, you know, does that make everybody go up on guard? Is that a good idea? Do kids have a good understanding of bullying? Does we make the call, and we call it bullying, and does that set everybody off? And I think this point about the labeling of the bullying, do kids have a good understanding? Does the staff, do the parents, and just want to make sure everybody was nice and awake for that.
Mindfulness exercise.
Excellent.
Next one.
Just to punctuate that point. Anybody else on any feedback on the role play, whether you actually did it? I think a lot of people kind of talked through it, reflected on it, may not have fully gone through all the motions, but you kind of got the gist of this. It was also kind of interesting, which of the two calls to the parents was easier or harder? Anybody have any reflections on that? That was also an interesting conversation among a couple of the tables. Is it easier to get the call or give the call? Not sure either of the two were easier or harder, but hopefully it gave you a little bit of empathy of all those kinds of experiences of parents on both sides. So hopefully you have a little bit of reflections on practice in that situation. So as we move forward, I want to spend a little bit of time thinking about teachers' perspectives, and as we've just kind of had our own little head-bursting moment, we can think a little bit about teachers and school leaders and how stressful school situations can be these days. When I go into schools and talk to teachers about like, hey, you want to work with us on some projects, a lot of times these days they're like, oh my gosh, I've got so many things going on. It's really very stressful. And there's a lot of work on the neurobiology of stress. We have so many things that we're learning about the brain and the body these days. And that's not just how kids are experiencing stress, although there's a really great article that recently came out by Megan Gunner that summarized 40 years of neurobiology of the brain and body. Refer to that article for those of you that like to read some of the biology of stress. It particularly focuses on animal models and children. But there's also a lot of work on understanding stress in teachers and how that impacts the classroom environment. My colleague at the University of Virginia, Tish Jennings, and her colleague, and ours as well, Mark Greenberg, have done a lot of work trying to understand how we can help teachers use strategies around mindfulness and various models of how we can kind of slow down the experience that teachers are having in the classroom environment by helping them make better decisions and using mindfulness and contemplation and different types of practices that help modulate the stress response, and that improves decisions and how they interact with each other. And she has developed a number of different practices that have been bundled together in different kind of programs, some of which they've tested on children, and rigorous designs that use mindfulness and contemplation for kids as well as for adults that have shown to be very effective, some of which look at some of the neurobiology for children but also for adults. And there's a very large and robust body of research documenting how stressful the field of teaching is these days. And I want to kind of pause on this because we are continuing to develop interventions and programs that often are putting more demands on teachers, and the more that we ask teachers to do and deliver, and to be the therapist, to be the intervener, to be the deliverer, to be the first line, to be the one that's doing all of this work, we are burning out the workforce, and we need to be cognizant of that, and we need to take care of this workforce, especially as we have more bureaucratic demands, more workload, inadequate recognition, poor pay, all these kinds of things. And so we need to make sure that we are cognizant of these kinds of demands on this. This is happening. This is not a new problem. We have seen old data as well as new data to document this problem. And there are certainly areas where these problems bump up, especially in urban areas and early career, teachers of color. We have a series of projects that we focus on early career teachers, providing training for them in evidence-based practices like the good behavior game, one that has one of the best names in the field, and another program where we bundle that with My Teaching Partner, which is a coaching model. We've been training teachers in these two evidence-based practices to try to give them a set of tools as they enter into the workforce to try to help buffer them from some of the challenges that they might experience as they enter the field. And we also see a variety of challenges that they're experiencing, particularly in face of the COVID pandemic. We see twice as many educators compared to other workforce employees that are experiencing job-related stress. Data from the CDC. Our friends at the CDC come through yet again, helping us understand some of the challenges. This is not YRBS data, this is obviously employee workforce data, but 27% of educators are reporting symptoms of clinical depression according to the CDC, and 37% of educators are reporting symptoms of anxiety according to the CDC. So these are some national data that they have pulled together, particularly coming out of the COVID pandemic. So we have challenges in workforce, and you're probably well aware of some of these data. And unfortunately, when we have a stressed workforce, they tend to not make such good decisions. And so we tend to rely on kind of punitive and reactive discipline strategies. And when we have not just an individual that is stressed, but when we have a system that is stressed, that system tends to rely on more punitive disciplinary strategies. And so when we look at a stress system in general, has historically had discrepant and disproportionate types of responses to discipline. And so we as a society are really trying to work for a more equitable disciplinary reform. And there are lots of more positive approaches to try to end some of these inadequate and inequitable types of disciplinary strategies. And many of my colleagues in the room here are often very focused on trying to have more equitable approaches to discipline. I tend to focus on strategies like positive behavior support and social emotional learning. And I know there have been conversations at the tables about restorative practices. I love this paper that a friend of mine and friend to many in the room, Anne Gregory, had led, and this actually won a big award a few years ago for some of the leadership in the area. The good intentions are not enough, and the importance of centering equity. And so using data and using more positive strategies is really very important. And so having supports for teachers that address issues like teacher stress and the use of data, and having more positive approaches to discipline. And so it brings me back to this pro-social classroom model that Tish Jennings and Mark Greenberg have put forward is a very important one, and that centers these issues around teacher social emotional learning, competence, and well-being is very important in that. And so having these healthy teacher relationships with students is centered in that type of model. And not only is that important just for a positive climate, but in order to actually implement other kinds of effective programs, you actually need to have a healthy workforce and have a healthy climate in order to have healthy students. So if you don't have healthy staff, you're kind of at square one to be able to do these kinds of outcomes. And there are a variety of contextual factors, like you need to have strong administrator support and leadership within the school environment and good policies to be able to support those. And when you have a perfect storm like a pandemic, where you have workforce shortages and people that don't have the qualifications that we need to be healthy in that environment, and high turnover. And I would argue that although we are, quote, through the pandemic, we're in this peri-pandemic environment, that we have data to show that we just haven't recovered from this. And that a lot of our data about like tier 1, tier 2, tier 3 supports, we need to revisit those kinds of data. So looking at models like multi-tiered systems of support, where we have tier 1, tier 2, tier 3 kinds of frameworks, that we need to revisit like the proportion of kids that might need a tier 1 type of support. So if you follow that kind of public health framework, we used to think, oh, it's like 80% of kids might respond to a tier 1. Well, maybe it's not 80% of the kids. Maybe it's more like 50 or 60% of the kids. And we need more investment in tier 2 and tier 3 supports because the higher base rates of risk. See the first few slides I presented to you about we have more kids that are exposed to trauma and that have more suicidal ideation and have more high base rates of depression and anxiety. So when you have more base rates of those kinds of concerns, you're going to need more intensive supports to actually meet those base rates of concern. So I tend to think in tiers. I also think about data systems and practices, and that's gotten branded as a name called positive behavior support. But it could also be thought of an implementation science framework. So it's like the operating system on your computer. So I'm using a Mac today, but Macs and PCs are kind of similar nowadays. But when I open it up, it has letters and numbers, and it has an operating system that's familiar to me. So when I go into a school that's operating like a PBIS framework, when I was at one of the tables, I said, well, do you have posted behavioral expectations about keeping your hands and feet to yourself? That's like an operating system of setting expectations in the school. So that system in that school has a set of expectations that sets a predictable environment for that school. I mentioned to you collecting school climate data. That's a data system. There was a team in that school that reviews that data. There's certain practices about talking what bullying is and defining that. So there's a team that also reviews that policy and those expectations on a regular basis. So I'm talking in a data systems practices framework that's consistent across that school and reviewed on a regular basis. But if you start doing those kinds of things on a regular basis, then you've dropped that implementation framework and you have to start from scratch every single year. And I'm worried that when we have things like a pandemic and when we stop doing those on a regular basis, we have to rebuild that all the time. And then we don't really have a universal framework, and it makes it harder to do our daily routines. And so that's why, whether you call it PBIS or MTSS or Virginia Tiered Systems of Support or something, you've lost that implementation framework to do your regular business every single day. So that's why it's important to invest in those structures and those systems, much like having a framework on your computer that drives how you open and close different kinds of programs on your computer. So it's just a way of thinking about the everyday business that you go about doing the work in your school. So it helps you also implement other programs better. So if you do a social emotional learning program, or you do Oveus or some other kind of program in your school, and we actually have data that shows that if you're implementing some other program within a multi-tiered systems of support, you do that other program better than if you weren't doing it within a multi-tiered systems of support framework. So doing them in synergy, you do them better than if you were just doing them independently. So we've actually done studies of this to show that that synergy and that integration of those frameworks has a positive impact. So when we do multi-tiered systems of support through rigorous studies where we test this in 50 schools or 60 schools, we actually can reduce bullying and suspensions and aggressive behavior, particularly among higher risk students. And we also improve the outcomes for staff. We're not just improving outcomes for students, but we're making the organizational context better for adults to go about their daily routines. And everybody talks about like, oh, wouldn't it be great if I had a better principal or if I got along better with my colleagues? But implementing these programs in synergy, you actually do have better outcomes for your interactions with other people. And in addition to that, we also see that you're meeting the needs of higher risk students by doing these programs in synergy with each other. But we need to invest in infrastructure like coaching and data supports and doing them with high fidelity. Just showing up for a training for a couple of days, but not actually implementing and using data to make decisions about high fidelity and not thinking about it from an implementation framework and that operating system. It's kind of all a wash. And going back to that issue about disclosure and kids reporting about needs around bullying, it also shows up on things like threat assessment. I have a colleague at the University of Virginia, Dewey Cornell, who does a lot of work on behavioral threat assessment. And so similar to that, he has a concept of authoritative school climate. And so when you're in a context of kids feeling safe and supportive and having good climate, they're more likely to report concerns about threat. So like if they have a concern where a kid might have harm to themselves or other people, like a kid in a school with a gun, they're more likely to report those concerns to adults in the school when there's a supportive school climate, when they feel like somebody's actually going to respond, much like the bullying situation. If there's a good organizational climate, that good framework, and they feel connected to the school, they're going to go and actually get help when they feel that they have a good climate. And lo and behold, we actually can save money by doing this. We have developed a process for tracking cost. And I'm not making this stuff up. We actually have cost analysts and we have economists on our team. And we can save money. And this is when we go to the state legislature and we say, you know, this isn't just a feel-good program. We've actually done the analysis. And so we can save through mental health and through other kinds of outcomes like aggressive behavior and suspensions. And so you can cite these, they're published. We have published many studies, 7 in fact, to show that investing in positive behavior support, we can cut down on costs associated with them. And we've even built a cost calculator that you can access for free to track the cost of your different interventions in your schools, so you can access that through this website. And we are scaling this up across the country in 110 different schools through a rural website. And this is funded by the U.S. Department of Education. It's branded as a rural school mental health initiative because we're very appreciative to get resources from the Department of Education, along with my colleagues that are leaders on the initiative, Wendy Rinke and Keith Herman at the University of Missouri, who are part of this initiative, along with some colleagues at Montana. These are all rural states, including Virginia. And we built a early identification screening system to help find those kids that need support before they become the squeaky wheels. So this is a early identification system where we actually have teachers and kids screen for mental health concerns around attention, peer relations, externalizing problems, as well as bullying problems. And so we can intervene early on before they actually escalate to more serious concerns. So I'm going to kind of chat for a little bit about a particular framework that we refer to as our Double Check initiative. And we've been scaling this up through the Rural Center, and it addresses particularly coaching around culturally responsive practices. And we've been working on this framework that we refer to as the CARES model. And these are the 5 different dimensions of culturally responsive practices. It's currently free and publicly available. You can access it through this website. And we call it Double Check because we wanted teachers and school staff to double check themselves and reflect on their own values and their backgrounds before they respond to student concerns in the classroom, ultimately with the goal of trying to reduce disproportionality in the classroom, but also thinking about how their values and their experiences might influence the way they perceive students. But it's really around student engagement and classroom management. And these are the different elements of culturally responsive practices we focus on. And our work in this area came out of a systematic review that we had done, and largely because there's so many different professional development models around culturally responsive practices, many of which focus on attitudes and beliefs, but very few focus on behaviors. And while beliefs and attitudes are important, we didn't find that at the end of the day they were actually leading to any outcomes that were measurable. So we launched into this effort. We've been working on this since 2011, and we have pretty measurable outcomes. We've had a series of randomized trials to show outcomes that are pretty favorable with regard to outcomes around office discipline referrals for Black students, as well as improved discipline in the classroom by teachers. And it builds on Wendy Rinke's classroom checkup, and that's also publicly available and has been tested through randomized trials, and that's available through the classroom checkup online. I'm going to give you kind of a quick snapshot of that, and then I want to give you a little bit of time to use some practice around a framework called motivational interviewing, which is really at the crux of this whole thing. And I think that's one of the skills I'm hoping you'll get a little bit of a taste of today, because I think it's 1, fun, 2, impactful, and 3, a nice kind of takeaway of our time together today to help you think a little bit about what is a skill or a practice, maybe around bullying prevention or some kind of school-wide change or just some kind of efficacious practice you're thinking about adopting in your own life that you might want to think about taking away from your experience here today. And so I want to give you a little bit of an overview of the work that we do on the classroom checkup, and then I'm going to talk a little bit about motivational interviewing, and then you'll get to practice some of those basic skills at your table. And so that will be kind of where I'm going to take you in the next few minutes. But I want to give you a little overview of the classroom checkup and the work we've been doing on that, and then talk a little bit about the motivational interviewing components, and then you'll have a little bit of a chance to practice some of those core elements at your table. So, in terms of the classroom checkup, the background on the classroom checkup, it came from several generations of checkups, one of which was the family checkup that was developed by Tom DeShawn, who has since passed away, unfortunately, but he was a faculty member at the time at the University of Oregon, and he was a member of Wendy Rinke's dissertation committee, and he had used this model to engage children with aggressive and disruptive behavior problems and working with delivering this particular program within the school and family setting. And so Wendy thought, oh, this thing is so great, I want to use it with teachers in the classroom. And then as she learned more about the program, it was actually previously delivered, and many of you are probably aware of the drinker's checkup, and so it was used a lot with drug and alcohol training prevention program. And so they're all different kinds of checkups that have since been developed. The family checkup is probably the most widely known in our field of prevention, intervention. There are many different iterations of the family checkup, and it's very widely used as a family checkup. So Wendy's classroom checkup and our double check is a derivation of that. But the classroom checkup follows these different steps that are outlined here, and it's a very data-driven approach. that starts off with a teacher interview where the coach gets to learn a little bit more about the teacher's classroom environment. There's an ecology checklist, learning a little bit more about that individual classroom environment. It's very ecological in context. There's an assessment of the classroom setting, what's happening through observations that the coach does of the classroom environment, doing observations of opportunities to respond. I used that term earlier, so I'm trying to reinforce your knowledge of what that is, and different types of things that the coach would observe the teacher doing. And there are certain forms that would guide that process. And we're also looking at the students too in the classroom setting. All these tools are available both online, and then Wendy also has the book. And then there's performance feedback. And so everybody likes to get feedback, but sometimes that feedback can be in the green zone about strengths that things are going well. Sometimes there are things that are in the yellow zone that might suggest some possible areas for improvement. And there might be a few things that we might want to work on that are in the red zone. We have adapted this for some things around student behavior that are at the top. There's some teacher behaviors that might need some adjustment. And then we have modified this for our double check cares. Remember I mentioned those 5 dimensions of culturally responsive practices? Well, we've broken this down for some things around culturally responsive practices that the teacher might want to work on in our model. And so this is just areas of strength. So this is an example because nobody wants to get feedback that everything's in the red zone, right? You want to get feedback that you're doing some things well, because it wouldn't be very empowering to get feedback that everything's not going so well. So this is an example of some of the feedback that gets personalized. And here's a menu of options of things that you would want to work on, because you want to be empowered to make some choice. You don't want to be told what to work on. You want to be empowered to make some choice around things that you could work on. And so here's some goal setting. So the teacher uses our CARES domains to make some choices and set some goals about things that they could work on. And then you set an action plan. And what's kind of funny is I use this action plan when I coach our junior faculty, and I just did a PD for our senior faculty, and I used this same kind of tool. I actually modified it and they didn't even know. I took our same thing and I used all these kinds of things. And then I had one of my coaches who happens to be one of my assistant professors, and she came to one of my PDs and she's like, "You took that from the classroom checkup, didn't you?" And I was like, "Shh, I modified it from this." But it's actually kind of cool to take these action plans from our coaching world and take them into our real world too, because a lot of these same strategies are very helpful across our real world as they are in our practice world too. So you can take these and say what kind of actions you'd like to work on, description of the plan. These are some elements of the motivational interviewing, things like that. And what kind of supports are you going to need? There's a monitoring plan. What kind of challenges or successes, and comments. And this is where we get into some of the motivational interviewing, because nobody wants to be told what to do, and we got to be thinking how to break our historical patterns of just traditional coaching models. And so this is where we bring in some of the motivational interviewing. And so this is something we did not make up. This is based on the Miller and Rolnick work. So how many of you are familiar with motivational interviewing? I'm sure we have a lot of experts in the room. Great, you all can help us out. So these are some of the basic core features. So I am literally doing a very, very quick light touch version of this, just to introduce you to some of the basic tenets, again, to whet your appetite to learn a little bit more. They actually just released a new book. I think it is either dated 23, 24. I just bought it this summer and did some summer beach reading. This is the stuff I read on the beach, is the new motivational interviewing hardback book, not out in paperback yet. But very fun. I often think it's nice to reflect on different types of models for self-improvement. So I read motivational interviewing books to help improve my own outlook on life and change my own behaviors. But some of the things you're trying to focus on are listening for values. So you might want to be working to think in your own experience, but usually we think about motivational interviewing as something that you would use with someone else, not to someone else. You'd be thinking about discrepancies about where someone else is, or a group that you were working with and where they want to be versus where they are now. And you were looking for change talk, so words that they might be using that highlight a change that they are thinking about making. So adopting an intervention, or maybe thinking about improving the way that they might want to respond to bullying in their environment, or adopting some certain kind of practice, or thinking about, I want to exercise more or get more sleep or be more mindful in my practices. So it doesn't have to be about your academic life, it could be about your personal life. Think about expressing empathy, rolling with resistance. So if you're meeting with them and they're thinking about, oh, I can't do these kinds of things, I don't have enough time to exercise, I don't have enough time to intervene in bullying situations, I've just got too much work to do, I never see the bullying, I never really want to label it that because I have all these concerns. And supporting, those are kinds of the resistance you might hear about all these barriers. So rather than being like, don't say that, you just kind of roll with some of those things and meet them with where they are. Supporting their efficacy and hearing, where are they efficacious, where do they feel like they could make some changes, and lean into that. We actually use a values card sort when we're working with teachers, and so we cut this up into little squares and we have them map out and put in little piles certain values that ours are focused on our double check work. And so they might map into a little pile of certain values that they have. And so that way we can think about certain values. And so this is back to this listen to values. And you think, oh, well, I really value being happy, being a good teacher, working hard, and being fair. And so when I hear that person I'm coaching talk about those values and that discrepancy about where they are, what they have time to do relative to those values that they're working on, I can point out those kind of values that they're working on. And these are a few more of those kind of tenets of motivational interviewing. It's not tricking or persuading people to do things. It's a purposeful tool about behavior change. It's not therapy, but it is often used in that kind of context. But it's a non-directive and supportive conversation. It's easy to learn. It's not actually easy to learn. We actually just did a whole training for our team over the past few days. And we even do all this coding of all of our coaching sessions. And now we're using AI to code and machine learning and natural language processing to recode all of our transcripts. So it's pretty hard, and then we have to code all of that for fidelity. But in real life, it's some simple actions that we're looking for. So we have a fidelity tool that helps with that, and there are a lot of training tools. So it takes a long time to get good at. But there's some basic tenets that are helpful, as a tool that you can kind of practice and strategize. And we often joke on our team that my name's Catherine, so I'm like, don't let Catherine MI you into doing that. So there'll be like a joke that, don't let the boss MI you into doing that. So it's done with, not to. So don't let anybody MI you into doing that. So this will be our activity. So we're going to take a little bit of time here before we go into lunch, going into kind of an activity around MI. So choose a partner. You're really going to do this. Just practice if it's okay with you. And think about someone that at your table there that you would like to practice a little bit. You don't need to get like deep therapeutic kind of thing. Just practice some of the little basic types of things. Identify someone at your table. Identify a change you're considering. Maybe it's exercise or sleeping more or washing your face at night or, something easy, meditating. Or it could be you want to work on classroom management in your classroom or intervening in bullying situations, whatever it is. Consider that change that you're thinking about, and something that you might be a little ambivalent about, some of the challenges that it might take, and talk about that with your partner at your table. And these are a few things to kind of keep in mind as you work through this. This is, collaborative and evocative and spirited, and be respectful. Don't try to give advice to your partner there, just kind of talk through that and listen to this process. And spend a little bit of time thinking about some of these basic elements of motivational interviewing as you were talking with your partner at the table. And kind of reflect on this MI experience. We'll spend just a few minutes around this. One of the kind of roadblocks or traps is advice giving. And so when we are listening in on our coaches that are sometimes, they fall into this trap of like, whoa, you should do this, you should do that. And we're like, oh, that's not an MI thing. You shouldn't be telling folks to do certain things. And so if you are thinking about applying some of these strategies, you want to make sure that you are listening and reflecting back. Some of the other strategies that are used within the motivational interviewing is the ORs. If you do any additional reading on this topic, we talk about the ORs, and that's an acronym for open questions, affirmations, reflective listening, and summary of reflections. And so the open questions is like inviting somebody to tell their story, and affirmations are recognizing the strengths and acknowledging the behaviors that lead to the directions for positive change. Reflective listening is so you feel or sounds like. And then the summary of reflections, sometimes you would use that in like a transition of like, so here's what I've heard, or tell me if I've missed something. And one of my colleagues who does a lot of the training in this area, his name is Keith Herman. Every time, he's a professor at the University of Missouri, whenever I hang out with him, like he just talks like this all the time. And so I'm always like, Keith, I feel like, you just embrace these strategies, you live like this. And so, there's some people that just really do this kind of more naturally in their life. And then there are others that have to really develop that muscle. But it is, one, it's kind of fun. And two, if you have another person in your life, like a kid or a partner or something, you might want to start thinking about adopting some of these strategies, and you can find that they can be kind of helpful to think about adopting some of these strategies. Another element, and you'll see on our tools that I had shared with you, you saw those confidence or importance rulers. And this can be really telling when you start going into these strategies and like how important would you say it is for you to do this. So if somebody's like, yeah, I really want to start this exercise routine. So on a scale from 0 to 10, like how important is it for you to exercise? It's like, well, a 2. Okay, well then that's like probably not really that important for them to do that. So, but don't be judgy about that. No, it's like, okay, well you're a 2, that's great. So, what is it going to take for you to get to a 4? And like, why aren't you a 0? So it's like, don't be judgy about the fact that you're a 2. So those are some things about like how confident are you that you're going to actually adopt some of these strategies. So those might be some other kinds of things. So we already did this kind of activity, but I did want to just wrap up by mentioning a few of our outcomes of this double check work. And this has been a lot of fun and a lot of really hard work for us on our team, and we're just getting ready to launch into a big scale-up project in this area. We've been working in this area of using the motivational interviewing techniques and our coaching work in the positive behavior support framework, but focus largely on culturally responsive practices and classroom systems. And an online framework is kind of where we're moving more in this space. We had done a lot of in-person professional development as well as coaching, and we have done a couple of randomized studies at the elementary and middle school funded by the Institute of Education Sciences, and had some additional funding from the Spencer Foundation. And what was kind of cool when we got this Spencer grant, the idea came from one of our principals. She was like, well, what happens if you coach 2 teachers together and see if that helps sustain the model? It was a great idea. It didn't actually work out all that well, but still really very fun. And so the principal came up with this idea because we were doing all these principal support and training opportunities. And I would encourage you to, give good ideas to researchers, because sometimes they get funded. And it was really very fun to spend time with principals, meeting with them pretty regularly, and coaching principals alongside with our teachers as well. And then we did another study where we trained 41 middle schools using professional development as well as the coaching model. And we do observations in the classroom of teachers and students as well, and tested that. And most recently just got that paper published. My colleague Katrina Debnam, who's been very involved in this work, is the lead author, and I'm the senior author on this particular paper. And so we get teacher self-reports as well as observations, because teachers sometimes give us particular insights that are very helpful. And then we also want to do observations. And we more recently got a grant funded where we are now building on an observational tool called CARES 360, where now we observe teachers and get kid report as well. And that's kind of interesting. What do kids think about teachers' culturally responsive practices? And so we are doing all this work around measurement as well. And so we have this scale-up study going on at this time where we are coaching teachers remotely. And I was telling folks at dinner last night, I kind of wrote this grant as we were coming out of the pandemic, saying like, it's really expensive to go into all these schools and do all of this work in person. And so I wrote this grant kind of in a fury, saying like, we're going to do all of this online and not go into any schools. So now we're recruiting schools all over the country, doing remote data collection and all this coaching online. So it's been very fun to think about a scale-up study so we can coach teachers anywhere. So we are recruiting schools potentially in Buffalo. Wow! If you want to be in the Double Check Online project, you are welcome to call us. So I'm going to stop there because we are about 10 minutes shy of lunch, and I wanted to take a few questions if anybody has any questions based on anything. I am interested in your thoughts on the motivational interviewing. Any kind of thoughts and reflections on that? Is that a muscle you would like to develop and experience a little bit more? Anybody have any kind of warm up to that? I know some of you are probably much more formally trained, perhaps than I am. I'm sure we use it a lot in kind of as a means to an end, and I'm sure many of you are very formally trained. So I'd welcome your thoughts about why I would actually choose to do it in this setting. But we do find that a lot of schools are very interested in it, and in fact, on our online system, we have built in a very brief online motivational interviewing training because many of our schools find it to be a useful technique. And so we've built these modules that we find that coaches like to have a very brief training in motivational interviewing, and they find it to be a helpful, transportable technique that they can use in several different aspects of their work. So a lot of people kind of like a little bit of MI in their life. So I'd welcome any feedback or thoughts you have on motivational interviewing. A lot of people leave and they're kind of like, I tried it out on my husband when I got home and he cut the grass, which was, not exactly what Miller and Roland wanted, but people seem to think that that's a fun takeaway. Any thoughts on the motivational interviewing? Yes?
Has anyone tried the MRI with kids who are bullying or bystanders?
I haven't tried it really with kids and in terms of our work. I'm sure others have. I think as a therapeutic technique, there are probably other techniques I might try, but I would welcome, I see, Jamie, if you have any thoughts, because you work with others, or we have another program that we use called Coping Power that has a more clinical kind of element with kids with more cognitive behavioral and social emotional techniques. It doesn't really use MI, motivational interviewing. We do have elements of empathy and other targets that are more direct and skill focused. It doesn't really use motivational interviewing. We have other problem solving models that are built into it. We have the PIC model, problem solving model, but it doesn't really use motivational interviewing. It's more of a problem solving approach. I think this is a little more subtle, and that's a little bit more direct and more skill focused. I don't know, I'd have to do a deep dive around the assumptions in motivational interviewing to think that there's probably a little bit of a connection that might be a little more. But that's an interesting idea. Yeah.
So I think, especially in a school setting, correct me if I'm wrong, but this might be really good with kids that have oppositional defiance issues, because it's kind of focused on them rather than you telling them what to do. Is that kind of a situation where this is used then?
I mostly use the motivational interviewing for adults in like program adoption rather than with kids. I'd have to think a little bit more about that, but I would love some of my clinically trained folks kind of looking at my front row, Jamie, Julie here, any thoughts? What do you guys think? I'm gonna phone a friend.
I don't know that MI has been, I mean, when it was developed, it was really to address substance use among adult users, or like adult substance users. So I don't know that there's a lot of effectiveness or efficacy in kids. I think with kids, especially young kids, it would be really hard to use MI skills unless you have more directive tools.
Yeah, that's my thought too, because the interventions that I was mentioning, like the family checkup, it's more for the parents to choose different interventions and implement those interventions rather than kids to change their behavior. So when I was talking about like the family checkup, it's more about parents to implement different strategies rather than the kids to have a therapeutic change process. So it's more of an implementation issue and motivating the parents to do certain strategies rather than the kids to do strategies. And the same thing for these teachers to implement a particular strategy in the classroom. So it's motivating the change process for the teachers. So it's efficacy building to have a behavior change process. It's kind of earlier up in the chain.
I will say that all the probation officers in the juvenile unit at Erie County are trained in motivational interviewing.
Yeah.
So they do work with the adolescents in trying to do some change in their behaviors and move them in a more positive direction.
Yeah, well, I'm very supportive of MI, clearly. So. I think it's where in the change process you're hoping to use it. Where in the therapeutic process it would be used. But as the intervention in and of itself. Other questions or comments where I think is a condition for the change in the adoption and the motivation for the change. Excellent. Well, hopefully I've inspired you all to learn more about motivational interviewing. I certainly wouldn't consider you trained after today. Other questions, comments, reflections? Well, I think it is lunchtime.